There were 18,646 doses delivered yesterday. 4,921 of those were aged 5 to 11. There are 130,273 bookings that have been made in the last 7 days. About 86,000 of those were for a booster, and 37,000 of those were for first dose 5 to 11 paediatric vaccine. Parents are doing exactly what we've asked them to do and getting their kids vaccinated, and in fact we've already got about 4,000 kids booked in for their second dose. So we again thank parents for that important work. There are currently though 177,109 appointments available in the system over the next 30 days for people aged 12 plus. So that's first dose, second dose, and of course third dose appointments, as well as paediatric dose appointments as well in addition to that. So the key point here is a lot of people are getting their third dose, but there are many more who need to. They've fallen eligible. They've got that letter from the Commonwealth, and there are appointments just waiting for you to put your name beside them. And then of course we ask that those who make an appointment honour that appointment by turning up and getting their third dose booster shot. Now in terms of hospital, and I'm joined today of course by Professor Ben Cowie, Acting Chief Health Officer, and he'll speak a little bit more to hospital issues, but there's 1,114 people who are in hospital, 122 are in ICU, and 35 of those are on a ventilator. Sadly, 13 people with COVID have passed away. Of these, 10 have passed away in the last 2 days, so we send our condolences and our best wishes to their families. This will be an incredibly difficult time for them. In terms of case numbers, 10,337 people reported their positive rapid antigen test results through coronavirus.vic.gov.au/report. A further 17,791 Victorians received a positive PCR result from 59,031 tests processed. That gives us a total of 28,128 positive cases, and that takes the total number of active cases across Victoria to some 237,559. And I'm very pleased to be able to say that 73,000 rapid tests were handed out across 69 state testing centres yesterday, free, available to those who didn't need a PCR test but still needed to test in accordance with all of those rules and policies we've put in place in recent times. That brings me to today's announcement, just a progress report. We have said a number of times this week that as soon as we could update you on the very big orders for rapid antigen tests that we've placed, we would. I'm pleased to be able to confirm that the first 3 million of the 44 million rapid tests that we have ordered arrived on Friday. They'll begin to be distributed from tomorrow. So the first 3 million of the 44 million are here, and they will go out from tomorrow. They will be distributed to those who are working in sensitive settings and other essential workforces, for instance across the health system, emergency services, the disability sector, the aged care sector. We will prioritise, of course, as well those that have got a pre-existing condition which makes them more vulnerable to significant illness if they were to get the COVID-19, the Omicron variant, if they were to get this virus. Knowing that you've got it and being able to provide care and support as quickly as possible is important for everybody, but it's particularly important for those who've got underlying health conditions. This rollout of these first 3 million from the 44 million that we have ordered is on top of those quite staggering numbers of rapid antigen tests that we are providing through our testing hubs. There are something like 400,000 of those tests have been provided free across more than 60 of those testing sites in the last week. So we're very grateful, of course, for all of our workers who are doing a great job in running those testing centres, but they're doing more than just running PCR tests and taking swabs and sending them off to our laboratory workforce, most of whom are private, but they're also supporting people by providing them with rapid antigen tests as well. The first day we began this process, there was about 1,900 tests that were given out, and of course, as I've just reported to you yesterday, there were many tens of thousands, around 73,000 of those tests were handed out at state hubs just yesterday. So that has grown, that's meeting a need. Now 3 million is a very important start. We are working incredibly hard, pressing as much as we possibly can to make sure that each and every one of the orders that make up the 44 million are honoured and that those shipments arrive. We anticipate having all of those 44 million here based on advice we have as of yesterday by the end of this month or very early February. We'll try and keep you updated as best we can. 3 million is a significant first batch, and that takes some pressure off other supply chains, other rapid antigen test providers. That'll be 3 million tests that don't have to be sourced elsewhere, so that alleviates pressure, and we do acknowledge that there is some pressure across the board for these products. The final point I wanted to make, or two final points, sorry, as part of that distribution of the 3 million, 60 grassroots community, multicultural and multi-faith organisations will receive a modest supply but an important supply of those 3 million so that they can distribute them in a culturally appropriate way. It's most important that we use those connections, those links, those trusted voices that have served all of us so well over these last couple of years. So again, reaching into those proven and trusted networks to get these products out to people so they can get a result one way or the other as fast as possible to protect themselves and the people that they love, but also to protect our health system and the people who work in it. Just finally, before I ask Professor Cowie to speak to numbers of the day and any other comments he wants to make, as I said before, the two most impactful things, the two things that matter most, is isolating when you've got a positive result, or if you're a close contact or a household-like contact of a positive case, getting tested, of course, as part of that, and then getting your booster shot, getting your third dose booster shot. There are literally hundreds of thousands of appointments available. We're seeing steady growth day on day of people who've become eligible, going and playing that part, doing that important work, protecting themselves and everyone. But we need more people who have fallen eligible to go and make that appointment. They're there, they're available. That's just through our clinics. There are many hundreds of thousands more appointments in GPs, surgeries, and of course community pharmacy. We thank those partners and we thank everybody who's working across the board, doing the best they can, working as hard as they can in incredibly difficult circumstances. I know there are shortages of staff across the board. That's the nature of this Omicron variant, and the fact that whilst it's not presenting as anywhere near as lethal or as serious as Delta, it is wildly infectious and it is contributing to significant numbers of people in hospital, not in ICU, but on ward beds, people who are still unwell and need hospital care, and we don't have finite resources. We don't have an infinite number, I should say, of nurses and doctors and ambos. Our resources are in fact finite, and we need to acknowledge, all of us, that just as there are shortages of staff in different sectors of the economy, there are shortages of staff in our health system. More than 6,000 people, doctors, nurses, ambos, who can't report for work because of this virus and the Omicron variant. I thank everybody who's doing their very best and working as hard as they can. Everyone is doing that. These are challenging times, very difficult times, but together Victorians have shown that they can achieve anything, and we will get past this. But the key to it getting to a peak and then case numbers starting to come down is people isolating, and thank you for doing that, and people going and getting a booster shot. And whilst we've seen significant increases in the number of people getting boosted, getting their third dose, we're up over 1 million. We need more people because they're eligible. We need more people to go and make one of those appointments. Please do that. If there's one thing you do today or tomorrow, if you're eligible for your booster, please go online and book one of those appointments. It is the key to us driving down these case numbers. I'll now ask Professor Cowie just to make a few comments, and then we're happy to take any questions you have.
Thanks very much, Premier. So, as the Premier was just reflecting, it is great news that the tide is starting to turn on the supply of rapid antigen tests in Victoria, and we are all going to have significantly increased access in the coming days and weeks thanks to the government's investment. We know that it would have been inconceivable for people to think about screening with a PCR test before they go out to gather on a Saturday night or to go to any major event, but we can really start to move towards embedding this behaviour with the increasing access to rapid antigen tests that are coming forward. So with the system of self-diagnosis and self-reporting, we can also commence isolation periods sooner, so people come out of isolation at an appropriate time, and that's not delayed. But most importantly, I think, being able to link people to care, whether that's through the COVID Positive Pathways program, whether it's through their local GP, whether it's seeking advice from Nurse on Call, or indeed any element of our health system. And that's the really critical benefit that a rapid answer provides. So I think we should feel confident in this technology. I know that it's been a sudden shift in priority over the last few weeks. I certainly have confidence in rapid antigen tests and their place in what we're doing at the moment. If you have symptoms or you have close contact of someone with COVID-19, that means you are much more likely to return a positive test. And we know that the positive tests by rapid antigen test, when they have been followed up with PCR, that is greater than 95% of those are positive by PCR as well. So we can be very confident in the performance of this technology in giving people access to an accurate result, but doing so far more quickly, which is critical, both to inform the isolation periods that are an important part of controlling transmission, as the Premier just reflected, but also linking people to care. If you have symptoms or you're a contact and you are able to access a rapid antigen test, there's really no reason, and we recommend against going and confirming a positive test with a PCR in those circumstances, given the really high diagnostic accuracy we're seeing with these tests in the current environment when we do have so much COVID-19 around in Australia at the moment. PCRs still are important, clearly, so they have a role in confirming diagnoses in people who are less likely to be positive, those with no symptoms and no contacts, to follow up with confirmation. And they still have a role clearly in our hospital system for further diagnosis and management. But for almost everyone in the community, rapid antigen tests will become the first point of call, and as the supply increases, that will become an increasingly available thing for Victorians to do. So as the Premier reflected, we now have over 1,100 Victorians in hospital at the moment, and that's increasing significantly. That number is increasing significantly every day. So we are continuing to build capacity in the hospital system to support Victorians who have COVID. So that's not just through hospitals though, really important through COVID positive pathways, through the hospital and the home programs, doing outreach care for people in their home if their needs are higher than what we can deliver without that sort of outreach, but they don't need to be in hospital. And also through the recently announced Medi hotels that will take an additional several hundred bed pressure out of the hospital system. So Omicron is certainly leaving its mark on our community. That's plain for everybody to see. The second dose coverage has provided us that our really high levels of 2-dose coverage has provided us with increased protection, and as the Premier mentioned again, it certainly has a very substantial impact on why we've got so many cases in the community. But as a proportion, the number of people in hospital and intensive care is relatively low. But with the very large numbers, we obviously will continue to see increasing numbers of people in hospital and over time in intensive care. So now it's really that third dose that gives you the edge, and the idea that 45% of people who are aged 70 years and over have had that third dose is fantastic. We need to get that number right up, but I do note that that was at something like 35% middle of the week. So Victorians over 70 are really coming forward rapidly, and we need to see that continue. It's a real priority group for third dose vaccination. So COVID-19 in all its forms can be a serious illness. So even for people who have relatively mild or moderate symptoms, it can still make you feel really unwell, and maybe the worst cold or flu-like illness you've ever had. But for others, they will end up in hospital, and some will end up in intensive care. And it's important to reflect it's not just the short-term problems that can accrue from COVID-19. A proportion of people go on to have prolonged or long-term symptoms, so-called long COVID, and that is also a significant concern as we see the sort of numbers of people getting infected every day. So please get your third dose. Avoid this really clear and present and increasing risk by doing something really powerful for yourself and for your loved ones and for the community, and get your third dose. So, as the Premier said, it's fantastic that 130,000 people have booked a vaccine appointment in just the last few days, but we have 170,000 bookings open right now, so please go ahead and do that. Before we get back to work properly, and before the year really kicks off and people start to mix again in ways that they haven't over the last few weeks, before you get back into the swing of social life, noting that what's being faced by Victorians at the moment is leading a lot of people to, very understandably, not engage with life in the way that they would choose to, it's really important to get that third dose to give yourself that protection. So you can find out what GP or pharmacy appointments are available if you just Google Clinic Finder. You can visit a state vaccination hub. You book in through www.coronavirus.vic.gov.au. And if you know somebody who needs a little extra help in getting their vaccine, whether they're living with disability, whether they require a translator or other reasons, there is a heap of information on the website about the systems that we have in place to support every Victorian to make that choice and get the third dose. With that, I'll hand back to the Premier. Thank you.
Thanks very much, Ben. I'm happy to take any questions you have.
There are a lot of childcare workers who are furloughed at the moment. Can you foresee that free rapid testing eventually will start?
National Cabinet had a conversation, detailed conversation, not the first, but the most recent conversation about childcare, early childhood and schools, particularly with a focus on primary schools, last Thursday, and we will again have another discussion this coming Thursday, and we look forward to making announcements quite soon. The Deputy Premier as Education Minister and myself, together with many others in government, lots of officials are working really hard on the return to school, and obviously childcare is a responsibility of the Commonwealth Government, but that was part of the discussion that we had on Thursday, and we'll continue to work that through. But there'll be announcements for the Prime Minister to make in relation to that sector. We'll have more to say, I think, in relation to kinder and early childhood ed, schools, and particularly primary schools and indeed specialist schools.
And that younger cohort of children, do you know how many have had their vaccination so far?
No, but I'll get you an exact number. I've got, obviously, the ones I read out today were the most recent numbers, but I'll get you an aggregate number. We're seeing really significant performance. Parents are doing exactly what we've asked them to do. They've got themselves vaccinated first and second dose. Mums and dads, don't forget your third dose. That's just as important. And in some respects, in terms of trying to suppress these case numbers, it's even more important than paediatric vaccines. But we won't finish getting our youngest Victorians vaccinated if we don't make a fast start, and we have. And we're very, very pleased to see that we're getting many young people through that system. I know there were a few issues early on about getting appointments. It's really important to recognise and to remember that there are three elements to this. There are for boosters, for first doses, second doses, and for kids vaccines. There's our state clinics, there's GP clinics, they have GP surgery, and also community pharmacy. And all three, we're all doing as best we can, working as hard as we can, and we're very grateful to those who've come forward. But there are more to come forward, and we'll always encourage people. We want to get the numbers as high as possible. We're at 93% double dose. We want to see that reflected in terms of triple dose, and we want to see all of our young people vaccinated. That's our constant message. Vaccination at the moment, it's probably easy to come to the conclusion, oh, well, what are these two doses achieving? Well, they're not as effective against transmission as we had hoped because of this new variant, but they are keeping literally tens of thousands of people out of hospital as is the isolation work that people are doing in a very personal sense. It's all part of a plan, a National Cabinet endorsed plan. As challenging as this is, it would be infinitely worse if we were not doing all of these things, and that's why I'm so grateful to everybody who is playing their part.
Premier, there's research out today that shows that up to two-thirds of parents across the country say it isn't safe to send their kids back to school. What do you say to parents who are worried about something?
Well, look, I think parents across the board, whether it's parents in Victoria and in other states like New South Wales that had to go through long and very challenging periods of homeschooling or remote learning over these last couple of years, parents who are naturally concerned about the welfare of their kids for every day for every reason. Of course, these are uncertain times, but we will have school open day one of term one, and we will make that environment as safe as we possibly can, whether it's through the provision and the rollout of air filters, educating in a different way, many more classes outside, windows open, all of those sorts of things, trying to make those environments as safe as possible. As to details beyond that, National Cabinet, as I said, had a very detailed conversation about this on Thursday. Our team is working very, very hard. Professor Cowie, myself, Deputy Premier and others were involved in meetings as recently as Friday, and we'll have more to say. The Deputy Premier will have more to say about what school will look like. But parents can be reassured that every step that can be taken will be taken to keep their kids safe, but also to acknowledge that it's critically important that we get kids back into the classroom and that we have as close to a normal start to the education year as we possibly can. And that's why we're all working as hard as possible to get every kid back in the classroom day one, term one. It might look a bit different, but it's very, very important. Victorian parents have given so much, and based on health advice, based on the best of health advice, we will deliver the safest possible environment.
More than 90,000 Victorians got a text message yesterday saying their PCR test samples are no longer valid. What kind of a strain is that putting on the system for people who go to get tested and then their samples can't be tested anymore, they have to go get retested?
Yeah, as I understand it, the private labs across Victoria, and I take it this is probably something that's occurring in other parts of the country as well, the backlog was such that they simply couldn't process those tests in a timely way. They've made those announcements. Obviously, you'd prefer it to be a different way. But again, I thank everybody who is queued up for a test. I thank everybody who's isolating, everybody who's playing their part. These 3 million rapid antigen tests as part of the 44 million order that we've placed will take some pressure off the system. Obviously, case numbers coming down a bit and stabilising, that takes some pressure off the system as well. We were the first to move to a self-reporting rapid antigen test model as well as PCR testing. We were the first to be handing out rapid antigen tests at our state clinics. We were the first to place a massive order. All of these things contribute, but again, it's challenging, it's not easy at all. Our private laboratories, that's the position they found themselves in, and they've made those announcements. But again, I just want to thank people for the really profound way in which they are minimising and ultimately reducing the number of cases. As many as there are, there would be so many more. And whilst it's by no means easy to have 1,114 people in hospital, just think what that looks like when you've got 10,000 or 15,000 people in hospital. And that's what would occur if people weren't going and getting their booster, weren't isolating at home, weren't going and getting tested. Those private laboratories have been under enormous pressure. I thank their staff, they're doing the very best they can, but when you've got a backlog you can't work through, the right thing to do is to inform people of that, and that's exactly what those private businesses have done.
We're nearing 250,000 active cases. Are there any more discussions about further restrictions?
Well, again, we are open. There are many inconveniences on daily life, and as the Acting Chief Health Officer, Professor Cowie's just made the point in relation to social gatherings or getting back into the office, attending events, things of that nature, people have made their own judgments about not necessarily going out the way they might. That's a perfectly natural thing. We don't want more cases, but the key point here is this is not presenting in the vast majority of people who get it. It's not presenting as severe, critical, life-threatening illness. That's not to say that it can be dismissed or that it isn't important. There are still, as I said, 1,114 people that are in hospital. That puts enormous pressure on our system. The bigger pressure is the fact that we've got more than 6,000 staff who can't report to do the amazing work they would normally do because they've either got COVID or they're a close contact. So I know there are some out there that would say, well, look, it's relatively mild. Why don't we just let it run? The problem would be that we would not have 1,000 people in hospital. We'd have many, many more than that. And that presents a critical challenge for those who need care with COVID and because of COVID, but also those people who need care for totally unrelated reasons. Heart attack, stroke, cancer, road accidents, the list goes on. If our system is completely overwhelmed with COVID patients, who whilst they may not be in the ICU, they're still in a hospital bed and have to be cared for, then there will be no health system for anyone else. In fact, it will be incredibly difficult. If you were to just let it run, it would be incredibly difficult just to handle the COVID caseload, let alone anything beyond that. So we don't have rules in place beyond changes to ISO and the requirement to isolate away. We know that's causing significant impost. It's a significant inconvenience for people. But I have no advice to go any further than that. And we're doing everything we can to normalise this, to push past it, to provide the best care possible, but to have the place open and keep it open. And that's why getting third doses, booster doses, critically important. Isolating away, not contributing to more cases, but in fact stopping more cases and therefore more people in hospital is so important. It's why we're so grateful to every single Victorian who is playing their part. And I dare say that Premier Perrottet, Premier Marshall, Premier Palaszczuk, all of us as First Ministers, we're all deeply grateful for our communities and the strength and that real sense of purpose that they've brought to this. It is not where we want it to be, but that's the nature of this virus. Nothing's more important than a third dose, as well as, of course, remaining isolated if you're a contact or if you've got it. Well, again, as for legal arguments, they're being run in the federal court as we speak, I think. So I won't comment on, I don't think we could get a more active process, so I won't comment on that. And as for the judgment, let's wait and see what happens and any precedents that might flow from it. As I've said, I will make 2 points though. One, just get vaccinated. It's very simple. Just get vaccinated. And then everyone's time wouldn't have to be wasted with this. Secondly, this tournament, this Grand Slam tournament, one of the big four, is much bigger than any one person. Much bigger. That's why it's a Grand Slam. That's why it's the biggest thing in tennis in the first quarter of every year. And it's why it's one of our most significant major events. I would also make one further comment. There are some people out there who think that this has somehow had a negative effect on this event. Well, no. People can reflect on an individual, but I don't think that this has affected this event at all. It's much bigger than any one person. And it's going to be just fantastic to have crowds there, COVID safe. It'll look a bit different, it'll be a bit different, but it'll be run and won, and it'll be, as it always is, a really big and important part of our visitor economy, our tourism sector, jobs, our brand. I think some of this commentary about how it's been negative, this event is much bigger than that, much more important than that, and much bigger than the individual circumstances of one person. And I won't go any further than that because, as I said, it's in the federal court at the moment. All good, everyone happy? Excellent. If we haven't given you that figure already, we'll get it for you. Oh, look at that. How's that for rapid? There you go. Thanks very much, everyone. Have a good Sunday.